Welcome to the pharmaphorum podcast. My name's Dominic Tyre, and I'm pharmaphorum's creative and editorial director. In episode 22, Novartis' Stephen Baird talks about how COVID-19 will change the face of company culture, now and in the future. We look at how Novartis' own operations had to change in response to the pandemic, and the challenges that presented him as its Chief People and Organisation Officer. Stephen also talks about how his company's culture has already changed in response to COVID-19 and what he thinks the virus means for pharma's future working practices. You can find more details of this episode, including a download link for the podcast, and information about other instalments in the series at pharmaphorum.com/podcast. The Pharmaphorum podcast is also available on iTunes, Spotify, Acast and Stitcher, where you can find and subscribe to it by searching for Pharmaphorum. So, Stephen, thank you very much for joining the Pharmaphorum podcast. I wonder if we could start with looking at how Novartis' operations have had to change in response to COVID-19.
Hi, Dominic. Yes, like I think any company, we also had to make quite some adjustments. For us, there were two things that were very important. On the one hand, we wanted to make sure we could continue the supply of medicines to patients, because many patients' well-being depends on having access to their medicine. And then on the other hand, of course, the well-being and the safety of our own employees. We have three categories or three personas in our workforce. There are the people that work in our laboratories and our manufacturing plants to discover and manufacture drugs. Those jobs obviously can't be done from home. And there we made all kinds of adjustments to ensure that they could work safely and also adapt to childcare needs, crossing borders and all of that. Secondly, we have the group of people that work in an office environment, and there we immediately, like any company, switched to working from home. And we learned a lot along the way what the psychological needs were from our people, because what we wanted to do is make sure we take away their stress, their anxiety, so that they feel optimally prepared to focus on coming up with solutions to the challenges that they face, because ultimately they are the closest to the customer, they're the closest to the issue, and they have the best experience to come up with solutions. And that ranged in many ways from practical tips on how to work from home and use MS Teams, but also learning possibilities, childcare support, even an app that we launched to help them with their mental and physical challenges in adjusting to this new environment. And then there is the people that call on our customers who work in the field. For them, it was important that they stayed home so that we don't put an extra burden on the healthcare system, because, of course, we call on healthcare practitioners. And there we've seen a tremendous uptake and innovation in a digital way of engaging, whether that was the clinical trial monitoring or whether those were our customer representatives. There we've seen that we have seen a tremendous acceleration of digital engagements and innovation.
And when did those sort of plans begin to kick in? We've seen quite a rapid spread, of course, of the disease and on a global level. When did Novartis begin taking major steps in response to what became an emerging pandemic?
Yeah, as a company, we have always had pandemic preparedness plans, but as soon as we started to see the situation develop in China, we took measures not just to support the organization in China, but also anticipated that this could go global. A lot of our people have worked previously in vaccines and diagnostics, and so we definitely didn't underestimate this. So as of January, we started to learn, to experiment, And I would say that the experience of managing the situation in China has proven to be a real benefit when in March the entire world went into lockdown. And now, again, the China experience is proving to be useful as Europe is gradually returning to the workplace. And so, again, we continue to use a very careful balance between protecting the health and the well-being of our employees whilst making sure we can continue to supply those medicines.
And in terms of just that point, the protection of the health and well-being of your employees, as you mentioned, there'll be a large number of Novartis employees working in laboratories or manufacturing that it's not something that can be done working from home. What sort of protective and safety measures did you need to put in place for those employees?
It's interesting. We have, as a company, a culture of curious, inspired, and unbossed, and this became very, very relevant because, first of all, I think it's very important in situations like this to bring back the purpose of why are we in existence. And for us, this is, of course, all about improving and extending people's life. For people, it was very important to understand what I do is important and it matters, so that they care about, I need to make sure that those patients still get those medicines. At the same time, you then see that the basic pyramid of Maslow's needs kicks in. People are worried about their own safety, people are worried about their health, but also of that of their family. We saw schooling closures and you name it. So a lot of the measures were not just about the physical safety, but also creating mental bandwidth, psychological safety for our associates. So of course, in the labs, we're used to working with protective gear. A lot of our manufacturing sites are sterile environments. So luckily, the skills and the familiarity with taking precautionary measures are very high in those environments. But there we had to really make sure that at-risk groups would stay home, that we would have sufficient shift work and backup situations. But also we had to often step in because a lot of the workers, their children were suddenly at home. We have a lot of sites that are close to a border and cross-border workers, and initially it was hard for those people to get across the border. So we had to take some extra measures in terms of childcare support. We even saw a situation where some of our office workers helped out in the packaging department voluntarily, but they wanted to make sure we would continue to ship our products. In our office and our sales organization, one of the first things we did is actually guarantee job safety. We committed to no layoffs related to COVID. We paused any ongoing restructuring programs because we noticed that there was so much stress in the system that we had to already help people by at least giving them some reassurance about job safety. Then we quickly saw that people needed some support with homeschooling for their kids, for example. And there we found this amazing non-for-profit Khan Academy. And so we raised the awareness about that, but we also made a donation to Khan Academy because it was just a great tool to help our associates and other people in the world to do homeschooling when schools were not ready. We did all kinds of specific initiatives, whether those were recognition payments, whether those were trainings on how to stay connected with colleagues in a virtual world, every time on the basis of input from our associates. Because our belief is that best people to come up with solutions are our people, and therefore the role of management and the role of leadership is to be in support of your people. So you listen to them, you understand what their needs are, and as leaders you come up with solutions to support your people.
Mm-hmm. And in terms of maybe expanding the company's workforce or just replacing positions that maybe become vacant, is Novartis still recruiting? Are you still looking to bring new people on, even with all this this disruption going on?
We are. We have also at the same time asked our hiring managers to take a critical look. So in the last month, we still hired and virtually onboarded more than 1,000 people. Now we've asked our managers, as I said, to take a close look, as nobody can anticipate today what the new normal will look like. Will we have a need for different skills? Will work fundamentally change? So as a result of that, we are doing a learning session with all of our associates of, hey, what have you learned in the last 8 weeks? What is something that you want to keep going forward versus what is something that you also want to stop doing that we were doing in the old world and maybe in the future is no longer needed. That will possibly have a change on the mix of skills that we will need, and therefore we have also suggested to our hiring managers to slow down the hiring, but we have not imposed a hire freeze.
And if we turn now to look at Novartis' own company culture, you've touched a little bit on some of the key points within this, but have you seen the company culture needed to change in response to COVID-19?
Well, today I would say that I'm super happy and lucky that we embarked on a deep and rigorous culture change program almost 2 years ago, in the sense that I don't underestimate how much COVID is testing that culture, and we see that luckily the choices we've made 2 years ago are starting to pay off. Specifically, we're a business that is all about innovation. We're constantly trying to find solutions to our common enemy, which is disease, whatever disease it is. And so therefore, our most important asset is the human brain, the innovative thinking of our people. We've been inspired by Dan Pink's Drive book, which basically analyzes what really motivates knowledge workers. And it was interesting to see that a lot of management concepts date back to the Industrial Revolution, but that in reality for knowledge workers, there's three things that really matter. It comes down to a purpose, it comes down to mastery, so developing new skills, and it comes down to a level of autonomy, feeling that you have the possibility to make decisions. We've translated that into inspired, curious, and on boss, which are essential to the company, of course, in combination with integrity. But so for us, being driven by a clear purpose, secondly, have a learn-it-all culture where you're constantly hungry to learn new things, and then unbossed is a belief that in today's world that is so complex, the solution is always with the team, never with the boss. There's always more information if you have a diverse team that feels safe and included and comes up with ideas. We've been working hard, therefore, to build that empowered culture, to install that learn-it-all mindset and stimulate that curiosity and connect our people to our purpose. Today, that is really paying off because COVID is so complex, is throwing so many challenges at any organization, that the idea that you can manage this crisis by having a strong person at the head of the table managing this in a command and control way would be naive. The only way you navigate through this is having 108,000 brains committed to coming up with the many solutions we need for the many challenges that we face. And so a curious mindset, an empowered mindset, and all of that with a commitment to a purpose is really proving to be our formula to success during these days.
And amid all of this a crisis, as you say, of such complexity, on a personal level, what sort of challenges have you found you've been presented with in your role?
I think it's a very good question, and the initial reflex is fear. I would say of like I've never had to deal with something as difficult and complex as this. I will never forget the day that we made the decision to basically close the offices. And I came home and I looked pale, and my wife said, "What's up?" I said, "We've just decided to send 100,000 people home." So the initial feeling is one of discomfort. But then very quickly you need to practice what you preach, is the belief that the solution is within the team. The belief that if you offer people a holding, if you offer people a perspective, and if you remove obstacles for your team, then you will come up with solutions. So what was important is that very early on, I assembled a diverse team of people that really have expertise on the key things that we had to manage, that I freed them up from their tasks so that they had bandwidth and capacity to do that. And then that we brought the function together, our own function, but also the other functions with which we had to collaborate closely. And so a very regular communication, buying time, so taking input from the organization, resisting the urge to answer immediately, but say, let us understand this problem, let us look into it, and we will come back to you tomorrow with an answer. Because often the solutions you implement are not just a solution for a day, but for months, possibly for 2 years. And so it was always important for us and for me to find that balance. To answer your question, I have learned again that you can't do this alone, but that when you have a great team and you ask the right questions and you offer them the support, that you will be, and I was super impressed and surprised by the innovative thinking and the creative solutions that people come forward with.
Thank you, Stephen. So I'd like to wind up this episode of the pharmaforum podcast by asking you to look into the future and tell me a bit about what impact you think COVID-19 is going to have on pharmaceutical companies in the long term.
It's a great question, and I wish I could predict the future. If you had done this podcast 4 months ago with me, I would definitely not have been able to predict that we would be in this situation today. But if anything, I think, first of all, I believe that the pharmaceutical industry will be part of the solution that we're looking for, whether that's with an antibody, whether that's with an antiviral, or whether that's with a vaccine. Specifically in terms of the future of work, I would see a few things. For Novartis, it's definitely a reason to double down and accelerate our culture change in the sense that learning and that constant curiosity is more important than ever. That commitment to a purpose and that belief that the solution is with the team is more relevant than ever. I also think that how we work will now accelerate. There were many bad things about COVID, but I've learned from a lot of colleagues that they actually appreciated the virtual work, that they appreciated having more time with colleagues, that they learned that they don't need to jump on the plane, whether that's a good thing for the environment or whether that's a good thing for work-life balance. I think it will be a reality. So we are looking at a more distributed workforce where people can do their job where and when they want. We don't need to come into the office every day to do the job. So in the short term, even as our offices reopen, we have invited people back, but we've been very clear nobody is obliged to come back. And I think that will continue in the future. I would definitely anticipate that in the years to come, we will see far more distributed work models than we've seen before, and I'm optimistic about that.
It's great to hear some positives coming out of the current crisis. So, Stephen, thank you very much for joining me on the pharmaforum podcast.
Thank you, Dominic. All the best.
And that brings us to the end of this episode of the pharmaforum podcast with Novartis' Stephen Baird on how COVID-19 will change the face of company culture. You can find more details of this episode, including a download link for the podcast and information about other instalments in the series at pharmaforum.com/podcast. podcast. The Pharma Forum podcast is also available on iTunes, Spotify, Acast and Stitcher, where you can find and subscribe to it by searching for Pharma Forum. And don't forget to visit our website to sign up for daily or weekly email pharmaceutical news and analysis bulletins, and follow us on Twitter, where we are at Pharma Forum.